Oftentimes we get questions about complete physical exams, how often they should be done. What are your thoughts on a complete physical exam or a physical versus other ways of assessing a patient's health?
A multifactorial question again. It is age dependent for certain, no question. Very, very early on, more frequent, you want to see good development, you want to see a healthy development, and then you can back off on the frequency of doing so. Later in life, as you become an adult and you're in your middle ages, and as long your health status is good, the frequency can be very low. If you're not healthy and there are lots of different comorbidities, you may need to do it more frequently. As you get older, definitely the frequency should be done on almost an annual basis, so we can say, yes, we're checking in. The Canadian guidelines right now are in the middle for what we call a periodic health exam. Those tend to be more discussion-based. They tend to be less hands-on, more of a interaction with the patient about where are we at with doing certain things, whether it is physical activity, whether it is diet, whether it is getting regular dental checkups, getting eye exams, those kind of topics to see are they following, and taking care of themselves versus hands-on approach. If you have multiple issues, maybe diabetes, maybe COPD, maybe hypertension, all of those things may lend to being better assessed in a physical manner and having an assessment of one's body, whether it is the respiratory exam or a cardiovascular exam or a skin check.
Well, I think a lot of times patients, when they call to book, will ask what happens during a complete physical. So if you had to give the Coles notes of what would happen in a 30-minute physical that a patient's booking.
I like to always joke about the whippings and beatings and torturings that go on with the patient in an exam, which is not really true. Usually it is an assessment of the systems of the body. And I go from head to toe, and we do an assessment of the head and the neck, the chest, the cardiovascular system, the respiratory system, the abdominal system. Don't do a genitourinary exam too often unless we're dealing with things like a pap smear, or they're dealing with problems rectally or anally for one thing. We also look at lower extremities, joints, legs, muscle development, deep tendon reflexes.
In terms of screening, I know you said that there was different screening that are done for eyes, dental, etc. Are there common tests that you often order when someone comes for their physical exam?
Again, dependent on age. There are guidelines and recommendations that are very, very age dependent. Classic one is mammography for women. Usually it's done after a particular age. That age, there is a discussion about that currently, dependent on different guidelines. But as early as age 40, 45, for a fecal immunoassay test, they'll say that age is 50. Even abdominal aortic aneurysms, they say that age will be in your 60s at that point. Your physician, healthcare practitioner will know the different guidelines and what needs to be done at that point.
In terms of frequency of physicals, you said that at some point it might go to a yearly standpoint. If we're looking at an infant or a baby, child, adolescent, do they have a different frequency of appointments?
Good point. I'm a big fan of getting to know newborns, new beings into the world, and you might start early on by as little as every 2 weeks, just so that you can lay hands on the baby, lay hands on the child as it's coming into the world and making its own, because its growth is so fast at this point in time. You want to see that it is making the milestones, the markers, the changes necessary to go towards normal development.
Is there a certain frequency that you would see them once they've hit maybe 2 months or 3 months? Do you have a certain guideline?
For my particular practice, I like 2 weeks, 4 weeks, 6 weeks. I like the 3-month mark. I like the 6-month mark. I like a year. And then I like 2 years, 4 years, 6 years. there is a variety of different recommendations. It is also very dependent on how things are going. Are they meeting their milestones or are they not meeting their milestones? If they are meeting their milestones, it might be less frequent. If they aren't meeting their milestones, maybe it's more frequent. If there are some feeding challenges, if there's some supplementation issues, there are challenges with parental-child interactions. All of those things may necessitate a more frequent approach.
And then I guess in terms of frequency, so if it's yearly physicals, let's say for the older adult or middle adult population, child, adolescent is a little bit different depending on what's going on. Is it safe to say that people should at least follow up their family doctor, say once a year just as a touch base, or is there a recommendation of frequency?
Depending on the age, I think it is reasonable to touch base with the physician about how they're doing. One strategy I think that would be good for patients' understanding and clarity is at the end of the most recent appointment to say, when should we touch base next? And I think that the recommendations will be made by the clinician who is caring for it based on what they've experienced on the more recent assessment.